Samoan parents never expected to face such grief.
I was shocked. It was very hard for me to accept what happened.
It's very hard to lose a child. Sorry. She's gone and I never forget her. The way I try to teach her how to talk.
Measles claimed the lives of more than 80 Samoans, mostly children and infants.
2 shots of a vaccine could have saved those children's lives.
The vaccination rate in Samoa dropped to about 30% after 2 children died from a measles vaccine that was mixed with a muscle relaxant instead of water. Parents panicked, and anti-vaccination activists convinced them to avoid the vaccine. Then measles exploded on the island.
The hospitals and health clinics were overrun with very sick children, and there weren't enough healthcare workers and hospital beds to adequately deliver the services that they needed.
The Samoan government started a massive vaccination effort. It then turned to the CDC for help.
CDC also was asked to do training of healthcare workers to ensure safe vaccine delivery, as well as to monitor the quality of the immunization campaign that took place.
In 2019, more than 400,000 cases of measles were reported globally, with an additional 250,000 cases in the Democratic Republic of Congo. In the first 3 months of 2019, the number of measles cases tripled over the same period last year.
The main reason for failure to vaccinate against measles is families, communities are not having access to the vaccine.
2 doses of the measles vaccine will protect children from the disease, yet conflict and poor health systems in low-income countries prevent families from vaccinating their children. In rich countries, vaccinations are declining too. Some parents are opting out of immunizations. The United States tops the list, with 2.5 million children missing their first dose of the measles vaccine. In 2019, the CDC reported that more than 1,000 cases of measles in 31 states by late December, the highest number in 25 years.
Then in the United States now we've got measles outbreaks and epidemics are becoming a new normal in this country after we've eliminated measles in 2000.
The WHO took away the measles eradication status of 4 European countries because of outbreaks and their low immunization rates.
In other words, we're backsliding.
Samoa concluded its state of emergency just before 2019 ended, but the resurgence of measles remains a global health problem. Unless children get vaccinated, there will be more deaths and more measles outbreaks in 2020. Carol Pearson, VOA News, Washington.